I'm going to be demonstrating today how to use a new surgical guide from innoDent. This is a fully mechanical and fully adjustable implant surgical guide. We start by taking the guide out of the box, undoing or loosening the screw for the balancing arm on one side. You can see that the guide comes fully adjustable in all three planes of space. I take this model. I'm going to be replacing tooth number 19 with an implant. So I place the guide right out of the box with the guide drill portion directly over the implant space, and then I just adjust that cross arch form to get maximum contact with all of the teeth and tighten that one screw. Now the guide is going to be ready to register to the model. We do this by putting bite impression paste, on the three areas with retention grooves on the bottom side of the guide. With the bite paste, we put it back on the model, trying to get the drill guide over the edentulous space, and then let that cure. As soon as our bite paste has hardened, we can take that off of the model. Now we're going to put the model on our planning station. This acts a lot like a dental surveyor. It's fully adjustable in all planes. We're just going to take our model and put it in the base and tighten this thumb screw down to lock it onto the platform. I want to visualize space number 19. I've got a little tool that I call an alignment tool. What I want to do is, with the help of this guide station, is help me plan to put this exactly in the location that will be most desirable. So typically I want it to be perpendicular to the occlusal plane. I want it parallel with the adjacent teeth. I want it right over the edentulous ridge. So this acts as a second pair of hands to hold that alignment tool in place while I make sure that it is the ideal drill path that I'm desiring here. Once I'm happy with that everything is parallel and ready to go, I can remove that alignment tool, and at any time I can put it back, and because the guide station has locked it in place, I can easily recapture exactly what I planned. Now I pick up the guide, put it on the model. Now we want it to perfectly replicate what I just planned without it. There is one clamp. I'm going to loosen that clamp screw now. And then there are two screws that I need to loosen. That's screw number 2. That is screw number 3. Now the guide is fully movable. I can put my alignment tool through the hole where I'm going to be using my pilot drill, recapture it, and it is exactly as I had planned. Everything is parallel and perpendicular and over the ridge. So I can now tighten the clamp. I can tighten the other two screws, and that secures this guide to where it's ready to replicate exactly my planning that I've done on this model. I remove the alignment tool, take the guide off, and if I'm ready for surgery right now, I can take the included super glue, place one drop of the glue into the glue port, give it several minutes to harden, and it will be impossible to move this guide now. It will all be locked in place just for this patient and this tooth. I can go directly to the patient's mouth at this time and do surgery, or if I would like to take a cone beam image or some other radiograph, I have an X-ray pin. I'm going to put the pin into the drill guide hole. So now I've got an opaque object that is perfectly in line with the path of the pilot drill. I can take that to the patient's mouth, do my cone beam, and make any adjustments if necessary. If not necessary, I take my drill guide, my pilot drill, put it there. I'm in the patient's mouth. I've reflected my flap. I drill that pilot hole, and I have perfectly replicated right over the ridge, perpendicular to the occlusal plane. All of this in about 5 or 6 minutes.